Good afternoon, I'm Bianca Stockley, and today I'm going to be talking to you about the use of clenbuterol as a treatment for chronic obstructive pulmonary disease in horses. We typically refer to chronic obstructive pulmonary disease as COPD, but it is also known as HEAVS or recurrent airway obstruction. COPD is an allergic lung disease resulting in the obstruction of the lower respiratory tract, typically the bronchi and bronchioles. COPD typically develops in horses who are kept stable and readily exposed to allergens such as hay, with the peak incidence of disease occurring in the northern hemisphere over the winter months where the horses are almost exclusively kept inside due to snow. COPD is often compared to asthma in humans, with horses showing comparable clinical signs. In horses with COPD, we typically see a bronchoconstriction and inflammation of the airways with an excess accumulation of mucus. Horses will show various clinical signs, from something as simple to a mild exercise intolerance through to severe dyspnea with a characteristic elongation of the expiration phase. COPD is not a disease that can be cured as such, rather we use a combination of drug therapy and reducing exposure to allergens in order to control and minimize clinical signs. The main drug used for COPD is clenbuterol. Clenbuterol, also known as ventipulmin, is a beta-2 agonist bronchodilator. The drug binds to beta-2 adrenoreceptors on the smooth muscle of the bronchi, activating adenyl cyclase to increase cyclic AMP, and then activate protein kinase. This results in the relaxation of bronchial smooth muscle, leading to a bronchodilation. Studies have shown that varying observations of efficacy occur. Typically, if COPD is severe, the clenbuterol can result in improved lung function, but it may have no effect on clinical signs. Primary research published in the Equine Veterinary Journal, such as that done by Erickson and his colleagues in 1994, showed that when given at an oral dose of 0.8 micrograms per kilogram per day, only 24% of the 239 horses showed a response to the drug. However, this same study also demonstrated that incremental dosing over a period of days can increase this efficacy from 25 to 75%. These results were emulated in a similar yet much smaller study by Harkins and his associates in the Journal of Veterinary Pharmacology in 2000. They demonstrated that clenbuterol was a reliable bronchodilator and caused a significant reduction in pulmonary resistance. While these studies do show clenbuterol as a useful drug in their treatment of COPD, they are not without their limitations. The studies were not blinded and they were exposed to various degrees of bias. In order to truly understand the efficacy of clenbuterol as a bronchodilator, more extensive and controlled research should be conducted. However, I do believe that clenbuterol is a valuable and beneficial source to alleviate clinical signs of chronic obstructive pulmonary disease. Thank you.